Hi, good evening, everybody. My name is Joy Santoro. I am the president of Vesper Institute. I'm absolutely honored and excited to be here this evening with some of our esteemed faculty at the Vesper Institute. Tonight's webinar topic is IV sedation, from patient safety to practice transformation. I want to give a quick introduction of our panel this evening. We have Dr. Scott Sayre, a general dentist from Cincinnati, Ohio, who's been practicing and using IV sedation in his offices for over 40 years. We have Dr. Jay Reznick, an oral surgeon MD, coming to us from Los Angeles, California, and Dr. John Roberson, who comes to us as an oral surgeon from Mississippi. So we are thrilled to have them with us tonight and all of you. We want to dive right in and talk about what's going on in IV sedation regarding a general dentist, why Dr. Sayre does this in his office for the past 40 years. So Dr. Sayre, I'm going to start with you. You are often called a super GP. And I know there's no cape involved, although that would be pretty fabulous. But at the center of your practice, of course, is IV sedation. So I'd like you to tell us a little bit about your journey. If you can tell us what your practice was like before IV sedation and then life after you integrated IV sedation into your practice.
Thank you, Joy. It's a pleasure being here. So I did a general practice residency at Miami Valley Hospital in Dayton, Ohio, with Dan Becker, and it was fabulous. I call it the cowboy days because a lot of the requirements and things that are in place now weren't in place. And I spent hours with oral surgeons and did 6 months of general anesthesia and all kinds of things. So it was a different time. But because of that, I came out and I was doing sedation. I was the 15th credentialed sedation specialist in Ohio. And I've been doing this for more than 40 years. Thank you so much, Joy, for being kind. But I have a practice, 4 practices, 12, 13 docs. Everybody's credentialed in sedation. And that's pretty much what we do all day, every day. So we see special needs patients and medically compromised patients and patients who are fearful, a huge part of it. And I don't know, the first 5 or 10 years of my practice, I wasn't holding the vision, the idea in the same light. It was just like, okay, if you want to have your wisdom teeth out and you want sedation, fine. And you'd come across these patients that need 2 hours of cosmetic work or difficult situations with implants, or they couldn't get numb. And I decided about that time, it's like, you know what? Dentistry is no different than most medical procedures. And well over 50% of the patients out there, and I can name them, 36% of the people via the literature are afraid of the dentist. What about complicated situations, implants, sinus lifts, wisdom teeth, full mouth extractions, difficult periodontal treatment, all these things, medically compromised patients, orthopedically compromised patients. They don't want to sit there for 1, 2, 3 hours in your chair. They need to have sedation. So I kind of had a wake-up call. And ever since then, we've really been promoting and doing sedation. We hold it differently. It's like, this is what you need, Mrs. Jones. And quite honestly, it's the only part of dentistry that they're happy to pay for. Yes, I want to go to sleep. Okay, fine. I don't want to pay for the root canal. Can my insurance pay for that? But I'll pay you to make me comfortable. So, I think that your question was, what about the experience and the pain points? And, we just woke up to that. So I've been doing this for a long, long time, and that's where we are.
And how did you explain to patients that was, the move you were making? You said that you had these patients that wanted to be comfortable. They want to be put to sleep. They want to not remember this procedure. When you transitioned and you started doing IV in your practice, how did you explain that to a patient?
Joy, that was the easiest thing I've ever done. There is no explanation. If you go to the physician and they say you need to have a carpal tunnel, you don't question whether you're going to be put to sleep. You don't even question it. And look, I'm going to do this. A carpal tunnel is done way out here on your hand. The drape can be put over in this area. They can give you a brachial block. You won't smell it. You won't see it. You won't feel it. It's a 6-minute soft tissue procedure. Now I'm going to come into your mouth. I'm going to drill on your bones. Your ears are there. Your nose is there. Your mouth is there. All of your senses are right there. And people don't understand. Dentistry doesn't understand that these patients actually need some form of anesthesia. It's kind of a crime. And I'm telling you, this is the biggest change that we're going to see over the next many years in how we do dentistry, is because I just tell the patient, look, Mrs. Jones, you come in, have your sedation, and you won't even know we're doing it. And they're like, this is fabulous. What are you talking about? Nobody offered this to me before. All you have to do is offer it. It's not even a matter of, there's no sales, there's no discussion. You think these people want to be put into that kind of experience? No, they don't. It's that simple.
And it's interesting, just the fearful patient. It's more than just a medically compromised patient. You really offer this to a wide variety of all your patients in your practice.
Absolutely. Again, fearful patients are 36% of the population. Many of them you're not going to see until it's too late. And the general dentist that sees those patients in the office ends up sending them to the oral surgeon for the extractions, and then they get to do the dentures or partials later on. So you're seeing these patients and you're sending them out. And that's okay. We're not here to say you as a general dentist need to learn all these other things. But what if you do root canals and they don't want to do it? I get referrals from endodontists all the time because they can't handle the particular patient needs from a fear, gagging, can't get numb due to local anesthesia issues, can't get numb due to the fact that they have infection. There are huge numbers of reasons why general dentists need to be involved in some type of anesthesia. And so it's a really straightforward situation, and fearful patients are at the top. It's a huge portion of the population, and you win them over instantly by being able to take care of their fearful needs and issues.
That's great and so helpful to understand how you integrated that into your practice. So, Dr. Reznick, you're an oral surgeon, so a little bit different perspective here. I'd love you to talk to us a little bit about the benefits for the patient. So, I know, and everybody on this webinar knows, you are doing so much education, webinars, seminars, especially on this platform. We see you a lot. But you always bring the conversation back to the patient. So I'd love for you to share some of your experiences and perspective on how IV sedation dentistry actually and substantially improves patient care.
They are afraid to come to us. It's not like that they don't like us. I have patients come in all the time and say, I really like you, but I don't like coming to you in your office because of what I need to have done. And the biggest fear they have is sort of the fear of the unknown. What's going to happen? Oh, I need this surgery to be done, or I need 8 units of crown and bridge, or wisdom teeth out, or sinus lift, or wherever it may be. And again, as Scott mentioned, do they really want to be awake for that whole thing if they have no, with no choice? No, they want to be sedated. I probably sedate or put under general anesthesia 99.9999% of the patients who come to me for wisdom teeth. Okay? I want my patients to have a great experience. I want them to come in and say, wow, that was that was great. I don't remember anything. I had the really great nap. And, you know, this really makes a big difference. And from my side, it makes it so much easier to be efficient and productive and do what I need to do when the patient's comfortable. When the patients are squirming or they're gagging or whatever it may be, it's really hard to do good dentistry, good surgery, whatever you may be doing. Most patients all patients want to be comfortable. They don't want to feel anything. They want a good experience, and that's what we want to be able to provide for them. But if they can come and have their dentistry done while they're very relaxed, it transforms your practice. And I can just imagine, as a general dentist, I mean, look at what it's done for Dr. Sayre's practice. You can do longer procedures. You can do more complicated procedures. You can do patients who are very anxious, who are afraid to come to the dentist. They will be happy. They'll love to come to you because you give them this really fantastic experience to get their dentistry done. And it's no longer something to be afraid of.
So it's interesting, right? Because Dr. Sayre is a general dentist doing IV sedation. You're an oral surgeon doing IV sedation. But the one common thread here is that patient experience and
Exactly.
what the patient walks away remembering or not remembering in this case, as far as their dental procedure goes. We're going to switch now to Dr. Roberson. So we've talked about patients, we've talked about integrating IV sedation into the office. So Dr. Roberson, you and Dr. Reznick have been so involved with education. And I know, again, you've both been together on this platform many times. You've
Yes.
done everything from hands-on, in-person, online. You've talked to big groups, small groups, really everything. You are in the process of educating so many of your fellow dentists. And I'd love to get some perspective from you. So tell me, when we talk about IV sedation, what
Yes.
would you say are some of the biggest obstacles or fears that a dentist would have about whether it be taking the leap and starting an IV sedation course, but maybe even before that, about even thinking about having IV sedation in their practice? And then what would you say to these people?
Okay. First of all, thank you, Joy, so very much for having me. It is truly an honor to be here. I'd like to first start out saying that roughly 93 million Americans have some form of dental fear or anxiety. And for all of our colleagues out there that are thinking this, IV sedation can be a life-changing event for these patients. So, Joy, I like to categorize it as what I would refer to as the 4 Ps. When it comes to a fear for a general dentist thinking about, should I pursue IV sedation? And that would be a price fear, a permit fear, a preparation fear, and a place in life fear. So let's break down each of these. So the price fear, so many dentists are worried about the cost associated with such a course involving IV sedation. And due to the numerous hours that are involved with both online, didactic, and clinical, a course like ours of such high caliber is not cheap. But I would have you remove that right now and say, I will not call this a price fear. I will call this an investment in myself, an investment in my practice, and an investment in my patients. We have a very flexible, customizable schedule because many dentists, again, they're afraid they might be gone so long away from their practice. We have the online portion, then we have the in-person, and then we have clinicals. You make the decision when you want to do clinicals. So therefore, you're not out of your practice that much. The return on investment here, Joy, is significant, and it erases this price fear. And then you'll have an immediate impact on the patients in your practice. So that alleviates that right there. My next one is called the permit fear. gosh, what all do I need to obtain or achieve before I can do IV sedation? And the great thing about this, Joy, is that most of the state dental boards out there have a pathway for general dentists to learn how to do IV sedation. And it's typically 90 hours, 60 hours online, or didactic included, and then 20 cases involving patients as well. So with that, we have all of that set up, and we are ready to assist you on any of these issues involving your state dental boards that are favorable toward learning IV sedation. The next one is the preparation fear. Gosh, what all do I have to have and do to be able to do IV sedation? Now, yes, there is quite a few things you've got to learn, but have no fear here. We have a customizable document ready for you to help you with all of the many products, monitors, IV sedation supplies, IV medications to get you on track to learn IV sedation. And again, like I said earlier, and it sort of taps in, Joy, to the price fear about our schedule, online, didactic, and clinicals. We can work around your schedule. And then the final thing, Joy, is the place in life. Well, I just started my career. I don't know if I'm ready for IV sedation, or I'm in my 50s and I'm not ready for IV sedation just yet. You're always ready to learn IV sedation. This will elevate your practice to another level, because I hear many dentists in their 50s, I've already been practicing 20, 25 years. I don't want to learn this. Well, this, as I said earlier, will be a significant impact on your practice. Plus, eventually one day you may bring in an associate, just like how Dr. Sayre has done his practice with all of his general dentists that have come in with him. This dentist may also want to learn IV sedation as well too. So those are what I see right there, Joey, as the obstacles, but they aren't. They're a minor hurdle that all of you can jump over.
Absolutely. That's great. And it's interesting because, we do hear from dentists, and one of the things that they always say is, I'm thinking about it, but I'm not ready to
Right.
jump. I'm not
Right.
ready to jump. So
Right.
what you're sort of laying out for them is all of the groundwork for when they are ready to jump. So what happens to a dentist that's saying, okay, well, I'm ready to take the course and I'm ready to learn, but I don't know what to do Monday morning. Like, are you just like going to leave me? Do I have to wing this on my own? How does it work? So what's your response to that?
Okay, I was hoping you might ask me that, because the great thing about our program, we are with you every step of the way. When you activate your desire to be part of our program, we're going to meet with you before you start your online, and we're going to discuss that, get to know you, and we're going to set up when you'll take your online courses so that you'll be ready for in-person didactic. Then, Jay, myself, and Scott are all there teaching you in your in-person. And then we have our awesome simulation course on the last day of in-person. Then we turn you over to clinicals. And now you're working with IV sedation certified general dentists. They do the same thing you do every single day. So it's your decision when you move into clinicals. Do I just want to go straight through it, or do I want to go back to my practice? And then whenever you're ready, we're ready. All right. And then the great thing about it, after you graduate from our program, at any given time, that if you want to come back and do cases, that's open for you as well too. And as an added bonus for all of our graduates, we do a once a month follow-up webinar with all of our students. And that's an ongoing process, Joey. And I just love it, because you hear the excitement of everybody doing it. Hey, and we get to discuss cases. And it's basically, I like to call it the Vesper Nation. And it's all about making a better you, so that you can go out there and deliver a great product for your patients.
That's amazing because, as we all know, learning is ongoing. It never
Absolutely.
stops. And so I love that, the Vesper Nation
Yes.
continues to grow, but also learns from each other. And that's
Right.
so important because they're learning from the instructors, but also learning from each other as they're integrating IV sedation into their practices and probably experiencing some of the same pain points. So it's
Correct.
nice that we have that for them to share. So thank you for doing that.
Yes.
I am going to switch gears a little bit and we're going to talk about patient safety. So this comes up very often when we talk about IV sedation, when we talk about having a conversation of bringing IV sedation into your practice if you don't already have it. That comes up loud and clear from all of the dentists that are interested. So, Dr. Reznick, I'm going to start with you. Patient safety truly is the fundamental focus, not only of our IV sedation course, but should be the focus of all IV sedation courses that are out there. So, I'd love to get some insight for you on safety. So, if dentists are considering studying IV sedation and implementing it into their practice, what sort of mind shifts do we need to walk them through so that they understand what the patient safety focus is all about?
There we go. All right. So we are taught in oral surgery residency, as well as Dr. Sayre was taught in his, that nothing is more important than patient safety. Okay. That has to be your number one concern, no matter what you are doing. And there are a lot of different factors to what gets you to patient safety and makes that the top of the pyramid. And we teach you all those things that you need to know. You need to be able to take a look at the patient's medical history and their medications and know what's going on with them. Our online modules, as well as the in-person, cover all kinds of medical disorders that can affect IV sedation, is the way the patient's going to respond to medications, the way they're going to respond in general to being sedated. And so you have to know that part really well. As doctors, we have the mental capability to learn a lot more than we know right now. And really, being a lifetime learner is so important to always being at the top of your game. And so when you are learning these new concepts about how to evaluate your patient medically, knowing about all the medications, knowing what kinds of things can happen when you have a patient sedated, what can happen as far as their airway, as far as their cardiac response, as far as their mental status, and knowing that you can recognize if things are off a little bit and what you need to do to correct it. But more importantly, how to avoid those things. But if you get yourself in a situation where maybe the patient has an obstructed airway, you have to know how to manage that. That is so important. And this is something also that we're going to drill into you, that you have to have drills in your office at least once a month, reviewing all the different potential emergencies and how to handle them. Sedation can be very safe. Medical emergencies can happen no matter how experienced you are and how many times you've done sedations or general anesthetics or whatever it might be. What we will make sure sets you apart from your other colleagues that maybe do IV sedation is you know how to handle any emergency so that your patients leave your office the way they came in.
That's
which
great.
is walking out the door. And we want to make sure that they learn everything the right way and are extremely comfortable with what they're doing. They don't say, well, I think I can sedate this patient. I know I can sedate this patient and I can sedate this patient safely.
And it sounds like from what Dr. Roberson was saying, you also do a heavy focus on sedation, even starting on the mannequin day,
Yeah.
with the sim man and going through different medical emergencies as practice. Sounds like an amazing experience to give some of these dentists some confidence regarding safety as well.
Oh yeah, that's absolutely critical. And we go through didactically all of the medical emergencies. So the online learning, a lot of it is kind of background for the in-person. The
Okay,
in-person didactic, we synthesize that all together and bring it into the real world as it relates to sedation.
great.
And we cover all the medical emergencies from start to finish. Doses of medications, what to do, different types of equipment for maintaining an airway, how to use an AED, all those things. And then we go the next day to our sim man, which is a very sophisticated, I wouldn't even call it a mannequin. It's much more than that. It's a very sophisticated instrument that is used to teach us all in the most realistic way possible how a patient is going to respond and how we do a certain procedure. Um, we go through all the emergency drills. It takes an entire day. Okay. We don't just gloss over it like they do in a lot of ACLS classes where you're in and out of there, the mega code, everybody's out in an hour. We spend the entire day with multiple stations, multiple instructors that are going to make sure that when you walk out of the program and go back to your offices, you know what you're going to do. You feel 110% or 150% safe, and you absolutely know, um, what to do to give your patients the best experience. And as John mentioned also a little bit earlier, another thing that we do that I think is pretty unique is we don't just show you a bunch of drugs and a bunch of supplies and a bunch of monitors and tell you to go buy it on your own, because that's really confusing. Some things come from some vendors, some others. And so to make sure that you have everything you need on day one in your office, we actually comprised a list of exactly what you need. And we've partnered with a company that will supply all of that to you in a package at a discount for being in our course, which is great. And then you have that relationship with them ongoing. Whenever you need to order new supplies, you know exactly where to go to. And another part of our program when it comes to safety is your staff. Okay? Your staff is critical. They're part of your team. And if your staff doesn't know how to handle themselves and what to do in an emergency, and you haven't talked about how you're going to divide the various tasks that need to be performed if a medical emergency is occurring, it's very hard. If your staff doesn't know what's involved in putting in an IV, hooking up monitors, you're going to be fighting an uphill battle, swimming upstream. I guess I mixed my metaphors there at the beginning. So we really emphasize that you bring your staff, or at least the ones that are going to be with you clinically doing the sedations, with you to the course. And Dr. Sayre and his team are putting together or have put together a very strong educational program just for your team to know how to be their best and do the best for you, so that, again, patient safety is number one. And they will actually be there with you when you're doing your hands-on training, your 20 cases or more, so that they really feel involved. They really feel a part of this, rather than it's just something new they have to learn that they don't really want to. And so I think our program really kind of has it all.
Dr. Sayre, did you have something you'd like to add on safety?
Yes, thank you, Dr. Reznick. A fabulous information on safety. So apropos, staff is incredibly important. If you don't have staff you can rely on, and that's what we're here to do at Vesper, is to train everybody all all the people in the office, but I'm going to layer on another thing. If you're giving midazolam, it's reversible with flumazenil. If you're giving fentanyl or any other narcotic, it's reversible with Narcan, Naloxone. If you have nitrous oxide on, you turn it off. So most every drug that you're going to use is reversible, or you can turn it off for sedation in general dentistry. We're talking safety when you know what you're doing beyond bounds. And this is what most general dentists don't understand. So I just wanted to point that out, and thank you.
Yeah. And let me throw in one more thing. Not only do we tell you what monitors you need to make your sedation safe, but we also teach you how to read the monitors and understand what the monitors are telling you so that you can interpret the monitors and, act before things start to go south.
You have to be able to determine when to do what I just said.
Exactly.
And so Dr. Reznick is correct in that we're here to train you to understand when to respond.
Great. So, Dr. Sayre, while we have you here, so let's, I want to switch gears a little bit and talk about your team. So, just some perspective from you about what implementing IV sedation in your practice can do for your team. So, this is a really different perspective, right? We've talked about the patients, we've talked about what you do treating patients with IV sedation. We've talked about getting referrals. We've talked about all of these different things, but spend a couple of minutes with us talking to us about what a work-life balance or change happens when you integrated IV sedation into your practice. Maybe, tell us about your staff, about practice culture, anything that you think you saw a difference in when you implemented IV sedation into a general dentist's office.
Well, that's a great question, Joy. And, when we first started all this a long time ago, 80s, whatever, we said we're going to do this. We've grown to, in my main practice, 17 operatories. My other practice are 10 to 15 operatories. We have 13 dentists and, 130 employees. And the thing is, they really love this. They understand how we're helping patients. They understand the special needs patients and the one with the physician says you need a hip replacement. You can't walk anymore. You got to get your dentistry done. And they come to us and we do it all in one visit. More like the holistic dentist that takes care of them and handles the root canal, 2 extractions, the crown, and root planing all in one visit. When do you go to the physician and have a quarter of your gallbladder taken out? No, they're going to do that rest of it next week. You go and you have 1 bypass, but you need 4. No. So with IV sedation, we actually take care of the entire patient problem. We help them. The staff is enthralled with this. They love it. They think this is the best thing since cake because that's what they've been looking for their entire dental career.
Right.
They get to learn airway. They get to learn medications. They are involved in truly taking care of a human being and not ignoring them and saying, okay, Mrs. Jones, we did 2 occlusals in the upper right quadrant. Doctor doesn't want to do anymore. Let's go to the lower left next week. And the patient's like, I can't afford it, or I don't want to come in, or geez, those shots hurt. We deal with none of that.
Right.
So it is a truly different mindset, a different scope. The practice is different. Your marketing system is different. And your staff absolutely loves this.
Right.
We don't see multiple 1 or 2 or 3 composites or restorations on 1 quadrant. We don't have to see a whole bunch of patients, we see longer appointments and take care of the entire patient. That philosophy is different, and that's available with sedation.
And what's interesting about your culture in your practice, I know from being there many times, is you do have this really high rate of staff retention. And I'm guessing part of that is coming from this new mindset of culture of treating the patient so differently, having the different types of appointments, but you have staff that's been with you for so many years. Tell us a little bit about that.
Yeah. So, I do have a big practice, but I have staff that have been there 10, 15, 20 years and plus, because they really enjoy it. We have an economy that works. We actually make money. It's weird in dentistry sometimes. You always have the problem of younger staff coming in and moving, going back to college, getting married, all those different things. And you're going to have turnover. But if we have a staff that's been there for a couple of years, they might be lifetime staff. And then also, as our practice grows, because we do sedation, we offer them scholarships. We say, go become an FDA. We need 2 FDAs over at this practice. And, I've only been doing this for a couple of years. But an IV sedation practice can grow like crazy. It really can.
That's amazing. It's great. And it's great to hear that, even a young dentist who's coming in, look, some of the biggest pain points we're seeing in dentistry right now is staffing. So it seems like IV sedation could have some sort of magic to help with your staff, to help with staff retention, but also to give you a cohesive team in the dental office. And that's so important right now. Dr. Roberson, I'm going to bring you in. I'd love to get a little perspective from you about marketing an IV sedation practice. Now, obviously, as an oral surgeon, it's bread and butter to you. It's what you
Yes.
do. But when you talk to the general dentist coming into Vesper Institute to learn about IV sedation, they're trying to wrap their heads around, okay, I'm suddenly going to be doing IVs. How do I market that in the marketplace? How do I get that out to patients? And Dr. Sayre, obviously mentioned he's been doing it a long time. So
Yes.
people in his community know. What would you say, or what were your, sort of bits of wisdom for a new dentist that would be starting out using IV sedation in their practice? And how would they market that?
Okay, sounds good, Joey. Thank you so much again. So, if I'm talking to you, the general dentist considering this, what marketing aspects? I'm gonna have to say I'm stuck on the P word today. I'm gonna look at the 3 P's of patience, productivity, and practice. First of all, with patience. As all 3 of us have already pointed out to you, a large segment of the population will benefit from IV sedation because number 1, high anxiety. Number 2, dental fear. Number 3, the shot. Number 4, difficulty getting numb. Number 5, they may be prone to a severe gagging reflex. Or number 6, they just had a bad experience at another dental office and they're trying to get over that. Well, the IV sedation on all of that I've just presented, Joy, all of these can be alleviated with the incorporation of IV sedation in your office. Now, when it comes to productivity, Joy, with you learning IV sedation, your patients are going to be completely relaxed. You're going to have greater control, and high quality dentistry can be achieved in less time, leading to increased productivity. So patience and productivity, Joy, feed off each other. Let's look at that patient with the severe gag reflex. Every general dentist has experienced this. All right. Hey, I'm going to do this procedure under local, and the patient tells you, now my gag reflex is really bad. How much time have you spent with that patient because you're trying to inject, then all of a sudden, wait, I feel it. I got to take this bite block out. Look at all of the wasted time that has occurred. So that's why I'm saying if you learn IV sedation, you're going to be able to practice high quality dentistry, and you're not going to have that gagger constantly fighting you over, hey, I need to move the bite block or this, that, I don't feel right, stuff like that. They're asleep. You get to do your very best dentistry at that time. And then finally, Joy, I'm going to have to say the practice. What can IV sedation do for your practice? Now that you've added IV sedation, welcome to the club. All right. You're going to be unique. You're going to be different in your area. You're going to be able to offer a wide range of services. You're going to be able to treat those patients that you probably had to refer out. You heard Dr. Sayre say how many root canals he gets referred because people want to go to sleep during a root canal. Same thing with an extraction. And you may already be doing some extractions or root canals or implants under local anesthesia. By adding this, watch the productivity improve in your practice. And the other thing is, you're going to be able to market yourself as the guy that does, or gal that does IV sedation, because patients are going to search that out. Now, this is going to elevate your practice, Joy, but it's also going to elevate your professional profile in your community.
I think that's so interesting because, there are still so many communities that don't have anybody that can do IV sedation. So not only are you doing a service for your community, but you would also be a better partner with some of the dentists in your community offering that service, right? So that referral door opens both ways, and it's such an amazing thing to offer in a community that doesn't have it.
And Joy, you're going to have your fellow colleagues who just decide not to do IV sedation, but they're going to respect you because you learned IV sedation, and they see you as another channel in case one of their patients says, hey, I prefer to go to sleep here, and the nearest specialist might be 2 hours away. Well, I know that Dr. Roberson right down the road does IV sedation, and watch what that does for your patient practice in your area.
Absolutely. So Dr. Sayre wants to jump in and talk a little bit about financials, because obviously he is that general dentist that's getting those referrals. So Dr. Sayre, can you give us some insight there?
Most of my docs do over $10,000 per day in production because they can combine cases. I personally do a lot more than that. I'm not going to go into details. I don't have to. We have a huge practice, and it's all because of IV sedation. We were voted by other general dentists in the community, Cincinnati. 6 of our 13 docs, and 2 or 3 of them are up in Columbus, so that didn't even count, were voted best in class by the magazine that does this in Cincinnati. You don't do that unless other people are voting for you. So they send patients to us all the time. They refer people to us. Your practice is going to go uphill. I'm telling you, 2, 3, 4-fold. I can't tell you. I think it's inappropriate on this kind of a venue to say what I'm doing. I just want you to know that the economic process here is beyond compare. This is the item to consider, and Joy will give you my number. Then I can tell you personally any specific information you want. Happy to do that.
That's great. Thank you. So we have had an amazing time on this webinar, and I want to kind of bring all the pieces together here. So I'm going to bring all of our doctors back on to close this out. So there are a lot of dentists who absolutely love what they're doing and how they're currently serving their patients and their team. And we give you tons of applause for that. It's amazing. But on the other hand, maybe you are a dentist on this webinar tonight, and you are looking for a way to really streamline your clinical day, building your cohesive team, standing out in the marketplace, being
Mhm.
that IV sedation practice in your area that doesn't have it. Maybe you are looking to grow a strong, resilient business. And maybe, and probably most important is what these doctors would tell you, we want you to create the best experience clinically and then experience wise for your patients.
Mhm.
So to close out tonight, if you could all give me, what you think about how IV sedation unlocks all of these things for a general dentist who's thinking about taking an IV sedation course. So Dr. Reznick, we're going to start with you.
Well, I think we can truly say that bringing IV sedation into your practice is transformative. It changes the dynamics of your practice. It changes, how you're viewed in the community. That you are a doctor whose practice is elevated above the rest, who's able to provide this service so the patients who are fearful or had a bad experience somewhere else, and know they need to get treated, they know that you're the person to go to, whether you're in a small town, whether you're in a big city. Word gets out, and it really elevates your practice to the next level. And I don't think there's anything you can say that means more than that your practice now is a practice that everybody wants to go to.
That's great. Dr. Roberson, your turn.
Yes. Oh, great. Thank you. IV sedation is life-changing in all aspects. It's going to be life-changing for the dentist. It's going to be life-changing for your patient. And it's going to be life-changing for your staff. And it's going to be life-changing for your practice. Over the course of this discussion today, we have presented all of the reasons why IV sedation can take your practice to a whole nother level. Dental fear, dental anxiety, Joy, is never going away. So incorporation of IV sedation, we've already mentioned all of this before, will take on that fearful patient, and now you have a patient for life. Think about how many patients you can take care of now simply because you made the decision to incorporate IV sedation. And one other thing I want to say too, Joy, before I get off here, the two other gentlemen you see on the screen with me, it's an honor and pleasure for me to work side by side with them. We all enjoy what we do. We love what we do. Some of you might be experiencing, what else can I do to make my practice better? I love the fact I put people to sleep and they wake up and they say, this is great. How rewarding it is. But it's also rewarding to have staff members like Jay Reznick and Scott Sayre that I'm working with during the in-person didactic, because we're passionate, we're excited, we're animated, and we're focused on all of our students, because if you aren't a success, we aren't a success.
Exactly.
And it's about that relationship you have with your IV sedation instructors.
Mhm.
And that relationship is for life here.
That's great.
Yeah.
Dr. Sayre.
Oh boy. Oh boy, John, you just hit on it.
There's
You're
nothing
on
left
the
for us to
clock.
say.
He's on the clock.
Are you ready?
We're ready.
You just hit it, John. Relationship. If you don't do that, it's not going to work.
Right.
So, general dentists out there listening to this, go look at the main sedation book by, oh my gosh, sorry. 90%.
Yeah.
Thank you
Malamed?
so much.
Okay.
Malamed says
Okay.
it's like 89%. 90%. This is in the literature. 90% of the general dentists who take these courses do not do it in their office.
Yeah. We don't want that to happen.
Listen to
No.
me. That is not our commitment. We are here. We are going to change this. We're going to change it in the biggest way you can't believe. This is the beginning. Our scope is far more than this, but we need your teams involved. We need you involved. I can tell you that economically, this will change your life. I can tell you that this will change your practice. I can tell you that a satisfied asleep patient or a sedated patient is going to give you dramatic results for other patients. This is a game changer. I have another hour of talking. I can't do that.
Yeah.
So thank you all. I thank you, John and Jay and Joy. This is a game changer. You have to get involved. Joy will share my information. If you want to call me, call me. You want
Sure.
to text me? Text me. You want to send an email? Do it. We're here to support you and give you all the information you need to make this happen in your office.
Thank
Can I just
you.
jump in for 1 second? One thing I
Sure.
just realized none of us talked about is, well, not only are Scott and John and I passionate about teaching, but when you learn the hands-on IV sedation, it's not in an operating room where the oral surgeons are doing something. It's in the clinic in one of Scott's practices, one-on-one with
Yes.
his IV sedation trained associates who are doing general dentistry. And you learn the different techniques, whether you're doing a short case, an hour-long case, or a 3-hour-long case.
Yep. You get to see
And
it
I
all.
don't think any other program
Yep.
is going to teach you that.
And
or
we
give you
try
that
and make
experience.
sure that, and we try and make sure they're at least one day with your anesthesiologist who's putting the patient to sleep, and you're using airways and possibly intubation and getting to see all of that.
And you know,
Amazing.
Joy, one other thing too. All three of us here practice dentistry. We are not retired. All right.
That's right.
We are practicing dentists just like you. We're in that grind every day. We know what you go through. It takes a lot to run a dental practice. All right.
Absolutely.
And like I had said earlier about when you incorporate IV sedation, you're going to have higher quality dentistry because you can achieve so much more in less time now.
Mhm.
That's great.
Yeah. And another thing is that, we are all in the trenches and we've all been doing this at least 30 years. And there's not a lot that we haven't had to deal with. Syncopal patients, airway obstruction,
Mhm.
all kinds of things, hypertension during sedation. We want you to be able to leave our course being able to handle those without breaking a sweat like we do in our offices.
Great.
Okay. And that's so important to be able to handle an adverse event, whether it's just, a partial airway obstruction or whatever it may be, with calmness. Because if you start getting too excited because you're not sure what to do, you're not going to have a good outcome. And we do not want that.
Right. So before we turn it over to all of the attendees to ask you lots of questions, we're going to put a slide up now. This is contact information. So you can reach out to me directly if you'd like to know more about the programs at Vesper Institute, specifically for the IV sedation course. I'm happy to jump on a call with you, talk about our scheduling, our flexible clinic scheduling, what it takes for you to join us at the Vesper Institute in Cincinnati, Ohio. You will be taught by those three gentlemen, Dr. Sayre, Dr. Roberson, and Dr. Reznick. So it is an experience like no other to get you prepared to do IV sedation in your practice. Also, we'd ask you to go to vesperinstitute.com to learn more about that course as well. And now we're going to open it up for questions.